Hello everyone. Today we're going to talk about plantar fasciitis. We're going to talk about what is plantar fasciitis, what causes plantar fasciitis, what our treatment options are, and how we can treat plantar fasciitis. So let's start with what is plantar fasciitis. Plantar fasciitis is also known as the runner's heel, is an inflammation of the tissue that connects the heel bone to the ball of the foot. It's a fan-shaped structure that connects the arch and it supports the arch. Usually it is seen plantar fasciitis is seen in patients in the age group of 35 to 55, but it can happen in any age group. It can happen to a young athlete, it can happen to a runner, it can happen to a factory worker who have to wear steel-toe boots and walk all day long. It can happen to people who have a job which requires a lot of standing and walking, like teachers. It can happen to people who are in armed forces who have to be standing and walking in safety boots and have to march all day long, can also get plantar fasciitis. Now, how do you know that you have plantar fasciitis? So one of the classic symptoms of plantar fasciitis is sharp stabbing pain with first few steps in the morning, which progressively gets better as the day goes on. You may also notice that when you sit for any length of time, whether you're sitting in a meeting or you're sitting and driving and then you try to get up and walk, you will get that same sharp stabbing pain, which will progressively get better as you keep walking. You may also notice at times that the pain will be worse towards the end of the day. Now, so let's talk about what causes plantar fasciitis. So one of the most common cause of plantar fasciitis is faulty biomechanics. So if you have high arch, or if you have a flat feet, you are more susceptible to getting plantar fasciitis. The other cause of plantar fasciitis is obesity. So that extra weight on your body that's what's going through the heel and which is putting more load on the plantar fascia, which may lead to plantar fasciitis. The other reason for plantar fasciitis is pregnancy. So for the same reason that during the time when the person is pregnant, there's extra weight on the body, that's extra load on the plantar fascia, which can then lead to plantar fasciitis. The other causes that I can think of is leg-length discrepancy. So if somebody has one leg shorter than the other, it can also lead to plantar fasciitis. Improper footwear. So people wearing high heels or worn-out shoes which have not enough cushion, or people walking bare feet at home are more susceptible to getting plantar fasciitis. People also who have tight calf or have tight Achilles tendon can also get plantar fasciitis. Now, let's talk about the treatment options. So usually plantar fasciitis is a slow healing condition for the very reason that heel is a weight-bearing part of your body, and 50% of the weight of your body is going through that inflamed part when you're standing or walking. Now, if you look at it, an active person usually walks 10,000 steps a day. That's how many times that inflamed heel is striking the floor. Now, if you're a runner, it's even worse. Now, say for argument's sake, you're a sedentary person. Then we're still looking at 3,000 to 4,000 steps during the day, which keeps the heel inflamed and keeps the inflammation going. Now, surgery is usually not an option. Medication, you can take some painkillers or anti-inflammatories, but you will get some short-term relief. So if your problem is it's biomechanical problem like flat feet or a high arch, or say a leg-length discrepancy, or even a tight calf muscle, then those core issues have to be addressed first. In my opinion, physiotherapy is the best treatment option for plantar fasciitis. I'm a physiotherapist, and here at Triangle Physiotherapy, we treat plantar fasciitis on a daily basis. And today I'm going to demonstrate to you a few of the many options that we provide to our patients in treating plantar fasciitis. So we're going to start with some manual therapy, what we can do for our patients who come in with plantar fasciitis. So I have Radio here, who's our model. She doesn't have plantar fasciitis, but we're going to demonstrate to you some of the techniques that I use while I'm doing my manual treatment. So I have two kinds of cup here. I have the hard cup and I have the soft suction cup, and I also have the Graston instrument. These are all the tools that I use while I'm treating the plantar fascia. Now this plantar fascia hides behind this hard heel, which is a natural cushion that we have. And so in order to get to the plantar fascia, you'll have to distract the tissues and try to improve the blood flow and break any adhesions and scar tissues that are building up there. So we're going to start with just prepping the pot with the lotion, just so that it holds on to the vacuum and gives us a good glide. So we'll start with the first one, which is the hard suction cup. And this is what I'm going to do is to where the pain is usually on the inside of the heel, somewhere around here. So we'll take a suction cup and we are going to suction it out. And as I said, it will improve the blood flow and it will distract the tissues and prepare the part for the rest of the manual treatment that we're going to do. Now, I usually leave this on for 5 to 7 minutes, and it will see when we take it off, it becomes more red, and that signifies that we just brought some blood over there. Just for the sake of this demonstration, I may not leave it for that long, but if I take it off, even after holding on for like say 20 to 30 seconds, you may notice that there's a red spot here, and that's nothing but a blood flow that has improved in that part of the heel. Then I'm going to use this small suction cup, which is again a silicone cup, and it's a softer cup. And this time I'm going to glide it all along the length of the plantar fascia. So I'm going to take it here, get the suction on, and then we're going to run it all along the length of the plantar fascia. And I would do it usually again for 3 to 4 to 5 minutes, depending on the severity of the patient condition, and then I'll take it off. Once I'm done with that, I will be using the Graston instrument to break any adhesions and scar tissues that are building up along the plantar fascia, and also comb the tissues and the fibers. So this is how I would do it, and so I'm going to go and try to clean up the whole fascia, right from the ball of the foot all the way to the heel. And again, I would do this again for 5 to 7 minutes, depending on the patient. This might be a little painful. It can be even a little ticklish when it comes to sole, but again, it helps breaking up the scar tissues. Now, once I'm done with the Graston and with the suction cup, I would be using my thumb and digging in right into the plantar fascia, bypassing the heel pad and trying to find any adhesions that are building up there. Once I find those, I will try to break in with my thumb by doing some friction massage there. Once I've done that, I would try to spread the plantar fascia away from the core and try to relax the tissues that are tightening up in there. And then I would passively give some calf stretches. Now again, for the sake of demonstration, I'm doing this in a short span of time, but usually this is the whole treatment may take 20 to 30 minutes. Now, usually patients with plantar fasciitis may also have tight calf muscle. So what we do is we turn the patient around on the stomach and then also do some soft tissue release on the calf and try to release the tightness in the calf muscle. So that's something we do in terms of manual treatment. Now, one of the most effective modality that helps in relieving the plantar fasciitis is shock wave therapy. Now, if you have been to any physiotherapy clinic before, you may have heard of ultrasound, lasers, interferential current. They all help in reducing the inflammation, but clinically it's proven that shock wave therapy will give you faster relief when it comes to plantar fasciitis. Usually we're talking about 7 to 8 visits before the patient starts noticing the improvement with shock wave therapy. Now, the other options that we have at Triangle Physiotherapy, what we do in terms of treating plantar fasciitis, we do taping and bracing. So in taping, the whole idea is, as we just discussed, that person takes usually 10,000 steps, and that keeps the inflammation going. It's hard to heal because it's the amount of walking the person does during the day. So by taping, what we are trying to do is we are trying to extend the treatment beyond this session so that the patient plantar fascia stays unloaded, and it will reduce the inflammation from building up as the day goes on. So we use different kinds of tape. We use the stiff tape, which are called as the Leuco tape, and we also use the elastic tape, and in our clinic we use the K tape. Now here I have 3 strips of tape that I'm going to use for this. Today I'm going to demonstrate to you one technique that will that we're going to use to unload the plantar fascia using the K tape. So I have 3 strips. I have the one long one and I have 2 short ones. The long one is the one that I'm going to put first, and I'm going to try to ask the patient to stretch it all the way back as much as they can, and try to apply it right on the heel. And then I would apply a 50% stretch to the tape and try to put it all along, and leaving the end again without stretch. And then just rub it in just to warm up the tape so that it sticks onto the plantar fascia. The second tape is the small tape that I will use. I will be putting it on 100% stretch, and this one I'll be putting on the metatarsal, or the ball of the foot. Again, it's where the tissue is attached to the bone. So once that is done, I'll use the last tape. I'll just be putting it just before the heel, trying to lift the arch up and unload the plantar fascia. So again, I'll put it at 100% stretch. I'll put that thing in, and that's the tape that we do for plantar fasciitis. It's a very effective technique which will keep the fascia from tugging against the heel and will reduce the inflammation the next day. So that was taping. Now let's talk about bracing. So one of the brace that I highly recommend my patient is the brace which is from Aircast, and it's called Round the Clock Relief for Plantar Fasciitis. Now this brace is unique because it again gives you a 24-hour relief from plantar fasciitis. It has 2 components in this box. One is, let's look at it, what it has. So one of it is the big one, which is you wear at night, and then there's a small one which you wear during the day. So let me just show you what it looks like and what it does. So the first one here, it's like a socks, and what it does is basically keeps your calf on stretch, and also your plantar fascia on stretch. So when you wake up in the morning, your calf is all stretched, your plantar fascia is stretched, and it will reduce that pain that you get with first few steps in the morning. So typically it's like a socks. All the patient has to do is to put it on and leave it on all night long, or as long as possible after they've done the work. So what we do is we just put that on. It's like a socks. You put that on, let's have that, and it goes up there, goes up there. There you go. There you go. And there you go. And then there you have a strip here which you can put the person's foot in as much stretch as possible, and then adjust the strap. And this will be left on all night long, and again it will reduce the pressure on the Achilles tendon and reduce the pressure on the plantar fascia. So this is a really good brace that helps patient reduce the pain in the morning. Once the patient is up and about, then the next component comes in, which is right, and that's the component which is the day brace, which is has 2 air compartments, and the air flows between the 2 compartments and so this is what it is. It's that one compartment here, and you have the other compartment here. So every time you walk, this is what's happening. If you can see, then you can see the air flowing between the 2 compartments. The idea is to create a cushion between the heel and the floor, and reduce the impact of that strikes that you're going to do when you are going to walk. So it's very easy again to put it on. All you have to do is to glide it up. There you go. And you put this thing on. And every time you're walking, this is the pressure, and it builds up and it goes back and forth. So this is again a very good way to reduce the pressure on the heel. Now let's talk about so let's take this off so that we're going to show you something more. So let's talk about what you can do by yourself at home. So I would give you a few good exercises that you can do. There are lots of exercises for plantar fasciitis, but we're going to discuss 2 or 3 good ones. So as we all know that with plantar fasciitis, you have this pain that gets worse with first thing in the morning. So before you get out of the bed, what you do is we call as heel rolling. So what you're trying to do here is you're trying to roll the heel clockwise and then you're going to try to roll the heel counterclockwise. And you do that 25 times clockwise and 25 times counterclockwise, and then you get off the bed and you start walking. And if you have this brace on at night, then you would notice that it will not be as painful as it would be without doing all of these things. The other exercise that you can do with plantar fasciitis is, if it's the calves are tight, then you can stretch your calf muscles. The other exercise that I show my patient is, you can come up here and we are going to talk about the cobble curls. So that helps to build up the intrinsic muscles of your feet and try to strengthen them. So all you have to do is keep a towel on the floor and try to crunch the towel towards you. And you do that for 4 to 5 to 6 repetitions and try to bring it all towards you, and make sure you're doing it on a smoother surface like tiles or hardwood floor. If you're doing it on, it will be very hard to do it on a carpet. Okay, so that's an exercise that you can do 2 or 3 times in a day. The other exercise that you, which is very effective for plantar fasciitis, is rolling a tennis ball or rolling an ice water bottle. But in our clinic, we use what we call as an AccuBall. So there are 2 kinds of balls. One is the bigger one and one's the smaller one. The bigger one can be warmed up in a microwave, and it's a little softer, as you can see, than the bigger one, the smaller one, sorry. So the first thing I do is I ask my patient to start with the bigger one. It acts like a warm-up, and what they have to do is to just roll their foot from the heel all the way to the ball of the foot. They can apply as much pressure as they can, and they do this for 3 to 4 minutes. After they've done it, then comes the hard one. What we do with this one is, this one will help break the adhesions and the scar tissues. So here, and that's a little hard, and it's going to go, those spikes are going to go in and try to open up those tissues a little more. And that's what the patient can do again at home by themselves 3-4 times a day, and that would help in reducing the symptoms. So, so those are the few good exercises that you can do for plantar fasciitis. Now, let's say what happens if you don't treat plantar fasciitis. So if you leave this condition untreated for 4 to 6 months, usually you will notice that you will have the symptoms beginning to appear on your good side, which is where you didn't have the symptoms, but you were compensating, and that's where it builds up. You may also get a bone spur. Now, in a bone spur, what happens is now you have a problem on a bone level, and the plantar fascia was on a muscle or a tissue level. So you have 2 different problems that you have to deal with now. And even worse, it can affect your knees, your hips, and your back, because it will alter the way you will walk, because when the heel hurts, you don't strike the heel, and that may give you more pain and will create more problems in your body. Now, let's see if we have any questions, then I can take those. Do we see any questions coming in? All right, so what I would suggest, if any one of you or your loved ones think that they have plantar fasciitis, then they should see a physiotherapist and get themselves treated. If you guys are in Toronto or in GTA area, Triangle Physiotherapy have 5 locations. We are in Oakville, Mississauga, Etobicoke, North York, and downtown Toronto. Come by. We'll get you assessed, get you started with your treatment, and put your feet back on the road to recovery. Thank you for watching this video.